In the United States, it's now clear the lack of public health restrictions and reopening the economy too soon is killing people. New cases are surging in multiple states. In Florida, it's situation critical. More than 10,000 new positive cases of COVID-19 were reported today, and more than 112 people died. As Jackson Proskow reports, it's going to get worse because intensive care wards are flooded with sick people.
Florida's hospitals are in critical condition, facing wave after wave of COVID-19 patients, stretching ICUs beyond capacity at more than 50 hospitals in the state.
Unless you're as close to it as we are, you really don't understand how serious it is.
Leah Carpenter is both a nurse and a hospital CEO. With her ICU overwhelmed, she has had to convert an auditorium and classrooms to handle the influx of patients.
When you look at there being 10,000 new cases today, 15,000 cases on Saturday, do you worry about what's coming down the pipe?
Absolutely. I worry about it. I'm not really convinced that our numbers have even reached what they could be.
Florida's reluctance to lock down and refusal to mandate face masks has come at a heavy cost. More than 300,000 cases, nearly 10,000 hospitalized.
We still haven't been out of the first wave, and the cases keep growing. They keep growing.
Nurse Dana James says she's never seen anything like it. She's frustrated by efforts to downplay the severity of the pandemic.
We hear a lot from political leaders who say, well, look, the average age is coming down or the death rate has stayed low. I'm just curious what your response is to that.
Let's not just talk about the death rate. Let's talk about somebody who's not going to die, but is on a ventilator for months and months.
In recent days, the state's death rate has set new records, along with the daily number of new cases. Despite the governor blaming young people for spreading the virus, doctors say the patients showing up in hospital are increasingly older.
In the last couple of weeks, we have seen an enormous increase in the number of patients who require mechanical ventilation that are in their 60s and 70s, similar to what we saw back in March.
This time around, there are far more patients, and there's far less certainty that the virus can be reined in. Florida has vowed not to move backwards on its reopening. The frontline workers are left to brace for what comes next.
What I'm probably most concerned about is what's to come. Are we going to get control of this? Are we going to level it out?
Jackson Proskow, Global News, Washington.